Daily Health. There's a promising new drug for millions of Americans looking to lose weight.
Drug maker Eli Lilly says it has developed a first-of-its-kind pill that the company says can help with patients with type 2 diabetes as well. NBC News correspondent Stephanie Gosk reports.
New data and new promise for a powerfully effective diabetes and weight loss drug. No need for needles, Eli Lilly says it has a pill. The latest clinical trial suggesting it is as strong as Ozempic.
It activates that GLP-1 receptor in your body.
So people can potentially expect the same kinds of weight loss taking this pill?
That's the hope.
The clinical results out today are from a type 2 diabetes trial. Patients lost 8% of their body mass taking one pill daily, and blood sugar levels dropped dramatically, according to the company.
Which meant if a doctor tested them, they wouldn't even know that they had diabetes anymore.
The news comes as Pfizer recently announced it's ending development of its own daily weight loss pill after a patient experienced a possible liver injury caused by the drug in a trial. The company noting the patient's liver enzymes recovered rapidly after stopping the pill. The class of drugs known as GLP-1s has revolutionized diabetes and weight loss treatment in the U.S., but shortages and cost have made the most popular injectables like Ozempic and Mounjaro out of reach for some.
Is this pill going to be cheaper?
Well, one of the advantages of the pill is that it's easier to make in our factories. That should mean more people should have access to it.
And Eli Lilly says it is already being manufactured.
We've built up inventory. So the day that we launch, when we get FDA approval, which could be as soon as next year, we hope to be able to have abundant supply.
Eli Lilly says the side effects for its pill are similar to the injectables, with many participants experiencing digestive issues, but the majority not serious enough to stop taking the pill.
Having a pill that's taken at your convenience, I think can be a game changer for some people.
But obesity expert Dr. Melanie J. cautions that these drugs, whether injectable or in pill form, need to be managed by a doctor.
It is not some kind of silver bullet, is it?
It is not. It is not a silver bullet. And we are finding that in real world practice, we still have so much to learn about how to use these medicines.
Stephanie Gosk, NBC News.
And joining us now to continue the conversation is NBC News medical analyst Dr. Vin Gupta. People on weekly injectables like Wegovy, Ozempic, we know lost a greater amount of body weight, on average 15%. Clinical trials results show that people on this new pill are losing about 8% of body weight. Is it better to take injectables if you're really looking to lose weight?
Well, Kate, the short answer is we don't totally know the answer to that. These orals are just coming online. This is the first major clinical trial, about 40 weeks of data. But yes, it does look like injectables right now might be more effective at strict weight loss. But this study was designed for diabetes, type 2 diabetes, and we saw weight loss as a secondary outcome, which was fantastic, lots of weight loss. And my hope is that we start to see patients maybe start their regimen on an injectable potentially, and then quickly go on maintenance therapy on these cheaper versions, these oral versions that are easier to take to maintain the gains. And I think that's going to be the expectation moving forward.
Yeah, that'd be pretty remarkable because we've reported a lot on how folks on GLP-1 tend to rebound once they go off of them. Dr. Gupta, is there a chance this pill, though, might lose efficacy over time? And will there be an ability to increase the dosage?
Sinclair, those are great questions. The hope here is, we haven't seen tolerance really to any degree, any significant degree to the injectables. We don't know the answer to that for the orals quite yet. Will people just need to increase the dose to maintain whatever gains they have? Right now, the early data, though, is that they are maintaining benefit, and this is incredibly, incredibly effective because 700 million people across the United States could benefit from some type of version of this drug that's cheaper, easier to take.
All right, Dr. Vin Gupta, great to see you. Thank you.
Well, the hit TV show The Office is celebrating its 20th anniversary. The mockumentary-style show got off to a slow start in the ratings, but eventually found its